Good afternoon and welcome to our daily media briefings. Today I'm really excited to announce a new County of San Diego public information campaign, or awareness campaign if you will, to encourage citizens to stay the course, to stay at home, to maintain social distancing, and wear facial coverings in an effort to flatten the curve. Our campaign message is simple: stay in place, maintain space, cover your face. By taking these steps, I can protect you and you can protect me. We want everyone to get involved. We know there are a lot of creative people that are out there that maybe are at home, they have some extra time as they are working from home. So we are inviting all of you to participate in the creation of this campaign. Submit a photo of yourself holding a sign that shares who you are staying home for to protect. Perhaps it's your sister who is a nurse, your father who is a firefighter, a friend who is a grocery clerk, or maybe even your grandparents. Your photo could be featured as one of the faces of our community in this campaign as we work together to slow the spread of coronavirus. We've been saying that we're all in this together, and this is a great way for people to participate in the fight against coronavirus. To learn more about the campaign and to submit your photo for consideration, visit livewellsd.org/PSA. But don't stop there. Challenge your friends and family by posting your photos on social media and encourage them to do the same to help create awareness of the importance of staying home and protecting each other. Together, we can flatten the curve in San Diego County. So let's spread the word and not the virus. And I'm going to start this campaign right here, right now. My father-in-law is John Willett. He's 98 years old. In fact, he'll be 99 years in June. He is presently at Mount Covenant retirement home, and nobody in the family has had a chance to see him in the past 4 weeks. So I'm staying home for John Willett, and I hope you will get involved in our campaign. I know together we can do it, San Diego. Now let's continue with our briefing. We're going to hear first from Supervisor Nathan Fletcher with an update on the numbers, and then he'll be followed by Dr. Wilma Wooten, our Public Health Officer, who will give us a medical update. Supervisor?
Thank you, Supervisor Cox, and good afternoon. I think we should all be really proud of San Diegans. We should all be really proud not just of the stories of individuals running food distribution for those in need in the rain, or the stories of kids writing letters to our public health workers, the stories of volunteers fixing N95 respirators, or cops and firefighters honoring our doctors and nurses outside of the hospitals. It's not just those stories. We should all be really proud of the entire community, of the widespread adoption that we've seen, of the efforts to help flatten the curve, the families that have made the decisions to stay home, those who have truly bought in and committed to the actions that we're taking. And what we are seeing in San Diego County is progress. We have flattened the curve in San Diego relative to places like Italy, China, or New York, and those actions have bought us time. They bought us time to increase our ventilator capacity, our healthcare system capacity. Those actions have saved lives. But it would be the greatest shame to throw away all of that progress and to waste all of that sacrifice because we got impatient, because we got anxious, because we lost our focus. We have to trust what we are doing. We have to trust the path that we are on. We have to trust our public health experts, doctors, and their advice, and we have to trust one another to stay the course to see this through. We know that we will come through it. We know that we will come out of it. We will rebuild, recover, and reopen, but only at the right time and in the right way. And while that time will come, the time is not now. The time now is for us to continue to adhere to the guidance, continue to support one another, and continue to save lives. Before we get into the daily charts, I want to briefly touch on testing. We're seeing an increase in the availability of testing. We're seeing many new companies and entities offer tests. We're seeing all kinds of new types of testing, and that is all happening very rapidly. Dr. Wooten has previously walked through the 3 buckets of testing: what we do internally in our own county lab, what our hospital partners do, and what commercial labs do. And we expect to see in the near future an increase of existing approved CDC or FDA approved testing, but we are also seeing an increase in new, often more experimental types of testing. And our public health folks are doing an incredible job managing, overseeing, monitoring, tracking, and maximizing. But as a county, we want to increase our capacity to continue to evaluate, coordinate, and integrate these as seamlessly as possible into a regional effort. That means the ability to not only evaluate what testing we believe is most accurate, but also to work on the regional standards and protocols surrounding testing, ensuring we are maximizing our reach, but most importantly, maximizing the positive impact. We also know that the availability of widespread rapid testing is a foundational piece of any effort that must accompany any consideration of reopening our society, and we must have that in place in order to even consider what the next steps may look like. Understanding the importance of both of these efforts, both ensuring the accuracy and coordination of recovery, but also preparing for what may come in the future, our county is going to continue to increase our focus on testing. On top of what our public health department is already doing, we will be identifying a COVID-19 testing coordinator to help achieve these goals, to make sure we are maximizing our outreach, our understanding, and our efficiency. This person will work closely with our existing public health officials and all of the incredible work that they are doing, and will just serve as another way we can continue to evolve and integrate all of our efforts into what we are doing, and we will keep you posted on the progress of these efforts. We will quickly go through our charts and then hear from Dr. Wooten. Today we are reporting 68 new San Diego residents as positive cases, bringing us to a total of 1,761. Our testing, we're reporting 1,077 new tests. This brings us to a total of 24,430 tests performed throughout San Diego County. Out of that total of testing, you can see here the comparison between the tests and the positives. We remain relatively consistent in terms of a percentage basis. And then the next chart, again, shows positives, estimated recoveries. And again, I want to point out this is an estimation following best practice. It is a statistical estimation. It is not a tracking of each individual person. And the estimated recovery ties directly to the positive cases. Those two go together. And then you can see our number of hospitalizations. Out of those hospitalizations, the number of those that are in an ICU, and then the unfortunate loss of life. Outreach efforts continue, increase in 211 calls, nurse calls, epi calls, increase in hygiene kits, and increase in hand washing stations that have been deployed. Our number of portable toilets distributed remains flat. On our personal protective equipment, we see an increase in every category, approaching the 2 million mark. On our County of San Diego public health motel rooms, an increase in the number occupied, an increase in the number of guests. Regional task force on the homeless rooms remains static from yesterday. And then the daily ventilator chart fluctuating a little bit just based on hospital reporting at the time of preparing this report. That concludes my summary. I'll now turn it over to Dr. Wilma Wooten to give you today's Public Health Officer's report.
Thank you, Supervisor Fletcher, and good afternoon to everyone. We cannot thank San Diego residents enough for doing your part to stay home to help fight this COVID-19 pandemic. Regarding the global, national, state statistics based on data from Johns Hopkins dashboard at 11 a.m. this morning. Globally, there are 1,733,792 positive cases that have been reported, with just over 106 deaths. Nationwide, there is just over 508,000 positive cases reported, which includes almost 20,000 deaths. Statewide, there are 21,408 positive cases, which includes 599 deaths. And today, the County of San Diego is reporting 1,761 cases, which is 68 cases more than reported yesterday. As well, this includes 45 deaths, which is one more death than reported yesterday. And this particular death is sadly a male in their early 80s. Of the 1,761 cases, the age range again is from 3 months of age to 100 years of age. 917 or 52% are between the ages of 20 to 49 years of age, and 810 or 46% or 50 years of age and older. 853 of our total cases, or 48%, are female, 902 or 51% are male, and there are 6 cases, which is approximately 0.3%, that have no gender identification. 396 or 22.5% of the total number of cases have been hospitalized, and this includes 144 or approximately 8.2% of the total number of cases have been admitted to the ICU. This number is 36% of the total number of those hospitalized. Lastly, the 45 deaths represent 2.6% of the total number of cases. All but 2 of this total number had underlying medical conditions, which is one reason that we have, from the beginning of this COVID-19 outbreak, encouraged and strongly recommended that individuals that are older and with underlying medical conditions stay at home. 42.2% were female of the 45 deaths. About 58% were male. Regarding race and ethnicity of the deaths, we have data for 36, which is 80% of the total number of deaths. 21 or 58% are white, 12 or 33% are Hispanic, 2 or 5.6% are Asian, and 1 or 2.8% is of multiple races. None of those who have died are African American or Black, Pacific Islanders, or American Indians. So our sincere sympathies and condolences once again go out to the family and friends of the death that we have reported today, and continuously go out to those who have also lost loved ones due to this epidemic and outbreak. So as a reminder, all of our demographic information is on our county website, and the county website address is right in front of me here at www.coronavirus-sandiego.com. Regarding outbreaks in congregate and community settings, today we are reporting a cumulative total of 30 confirmed outbreaks. This includes 20 outbreaks in congregate facilities with 1 new outbreak, representing 182 cases and 22 deaths, and 10 outbreaks with 2 new outbreaks in community setting locations, representing 41 cases and 1 death. Today, I am excited and honored to recognize, in honor of National Public Health Week, Dr. Penelope Jenny Quintana as the individual award recipient for the 2020 Live Well San Diego 19th Annual Public Health Champion Awards. Dr. Quintana has been active in the community at regional and state levels as an environmental health professor for San Diego State University Graduate School of Public Health. She actively promotes research, robust public engagement, and effective public policy for the improvement of air quality in disadvantaged communities along the U.S.-Mexico border, especially in the community of San Ysidro. Lastly, during this National Public Health Week, I want to thank everyone in San Diego for the physical distancing to protect our community and to stop the spread of COVID-19. Thank you to everyone. Now please welcome back to the podium Chairman Greg Cox.
Thank you, Dr. Wooten. We're going to go directly to the questions. We have 3 calls that are online ready to go. If we do not introduce you by your name and your outlet in the introduction, please make sure you do. Let's go to the first call.
Union Tribune, please state your name and question.
Hi, this is Jennifer Vander with the Union Tribune. I wanted to check in to see if San Diego was doing anything to provide assistance across the border to people in Mexico or Tijuana and whether or not there are scenarios in which our county would accept patients from across the border. Thank you.
Okay, I'm looking to see, I think Dr. Wooten's going to come and answer that question.
So there was a first part of the question. You wanted to find out if we are engaging with Mexico or Baja California, if I understood the question correctly?
Exactly, yes.
Sure. So yes, we are.
Assistance, yeah.
Thank you. Thank you for that question. We are indeed engaged with and have routine calls, regular calls actually, with leadership in the local public health jurisdiction in Tijuana, with the Mexican consulate as well. And both Dr. McDonald and myself are in various meetings across the border. So we are very sensitive to what's going on in Tijuana and are trying to work together where possible to help lessen the issues on both sides of the border. In terms of would we take patients from Mexico, that really would be an individual hospital decision or policy decision that would be made by individual hospitals. Does that answer your question?
That happened?
Pardon?
Sort of. Has that happened? Has individual hospitals taken patients?
Not that I am aware of in terms of a kind of a blanket policy or process. I am not aware of that happening to date. But again, individually, it would be up to the hospitals to make that policy decision. If individuals that are in Mexico are repatriates and they actually are U.S. citizens but are living in Mexico, certainly that would be a different situation.
Okay, let's go to the next question.
10 News, please state your name and question.
Hi, it's Vanessa Benhassi at 10 News. So I have a question regarding a nursing home in El Cajon. It's Avocado Post-Acute Care. We just had a viewer email us some concerns about that, and it just seems like it's a living environment ripe for cases to spread. She had mentioned there's 3 to 4 people per room, and just wondering if you're involved with this case at all. Have you advised this nursing home on how they should be proceeding with healthy patients? They've had 2 positive people there. I don't know if they're staff or patients.
Okay, Dr. Wooten will answer that question.
I think we've shared with the public and with the media in the past that to respect confidentiality, we will not give out specifics. In the report that I made earlier, any congregate living facilities that have an outbreak, we are in contact with them. We have a team that goes out to the facility to investigate their infection control and prevention measures that are in place, and we monitor the process at the facilities. Not only just those facilities that have active outbreaks, but we are also ensuring that we are working with congregate care facilities to ensure that even those without outbreaks or have had any particular cases are maintaining and implementing the appropriate infection control measures. So if you have a specific question, I would contact the entity that you are concerned with, but be reassured that we do have a process to manage outbreaks in our congregate living facilities. And it not only involves our staff here in San Diego, but state staffing also gets involved.
But in this case, they're saying there's 3 to 4 patients per room. So I'm just curious what you're advising with social distancing when you have 4 people in a room. How are you able to do that? Are you advising anything specifically on that?
That would be, social distancing is appropriate, and having individuals in a room is guidance. The number of individuals in a room is based on guidance from the state licensing and certification. So as long as, when our staff go out, that's one of the parameters that is assessed, and the facilities are provided guidance on. So I am not alarmed by having 4 people in a room, but they have to be people that are not in isolation or quarantine. You can't have individuals that are mixed, where you have some that are in isolation and some that are not infected. Obviously, that is not appropriate, and I would, as our staff goes out to assess that, they would make sure that that is not happening.
Okay, let's go to the next question.
Union Tribune, please state your name and question.
Hi, this is Paul Sisson at the UT. Hospitals across our region have been preparing for a big surge now for, I'd say, more than a month. I visited 3 hospitals yesterday, one up in North County, one in the city center, and one down in Chula Vista. It's my overall impression that the surge is really not overwhelming anybody yet, but that it does feel like there is a little more volume, COVID volume coming in the South Bay. I wonder if you could comment to that. Like, what patterns, what is the shape of the surge that we are seeing, even though it's not overwhelming anybody yet?
Okay, Dr. Wooten's going to answer that question.
So, Paul, I think you've given an accurate assessment of what the situation looks like, and we can think that it looks the way it does because we were quick to action, and we have implemented various social distancing strategies and decreased visitations, decreased elective surgery, so that we do not introduce, number one, COVID-19 into the hospital setting so that staff are infected or patients. The capacity has decreased, but again, that was what would be expected with the interventions that were implemented now probably about 3 weeks ago. So we are seeing what we hoped would happen, but on the flip side, now you have to worry about people are staying away. We don't want people to stay away that have real, true health emergencies. But this social distancing may have help with other, decreasing other health conditions, but it still doesn't impact people that might have heart attacks or strokes or other life emergent situations.
Yeah, Dr. Wooten, though, I wonder if you could say where the volume is falling heaviest in the county. Is it East County, South County, North County, out in La Jolla? Is there any pattern that you're seeing?
I have not looked at or seen a pattern across hospitals. Paul, you know that we do look at our capacity across the system, and the capacity, again, is looking like what we would want it to look like with the anticipation of the surge of COVID-19 patients. But on the flip side, because we have implemented all of these social distancing strategies, less infections are being seen across the county. So again, I would have to go back and we would have to look at the data to really compare hospital to hospital, but I don't have an answer for you at this point in time on that.
Thank you.
That concludes our call-ins. We do have, I think, 3 text questions. The first one is dealing with homelessness, and I'll ask Supervisor Fletcher to answer that question. Oh. Wilma?
What's the question?
Okay, I'll let you
Go
know.
ahead,
This
read
is
the
from
question,
Lisa
and Dr. Wilma,
Halverstadt.
come on.
Thank you, Supervisor Cox. This is from Lisa Halverstadt, a Voice of San Diego. Supervisor Fletcher said recently the county will not be reporting COVID-19 cases by housing status. Is San Diego County tracking the number of homeless San Diegans who have been tested positive for COVID-19? And can you shed any light on how many homeless San Diegans have tested positive?
Actually, I'll help address that question since I do follow the numbers very closely in terms of the individual case reports that come in. We do have cases that have been reported to us who have been homeless. Some have been identified who were in the field, and some were identified by presenting to emergency departments. What we do is with each of these cases track the potential close contacts and the settings that they may have been in to be sure that those settings don't have any implications in terms of person-to-person spread of the virus. So we aren't aggregating those numbers, just as we aren't aggregating those numbers by specific population or occupation, but we do know that there are homeless cases.
Dr. McDonald.
The next two questions are going to be responded to by Dr. Wooten, and we'll go ahead and hear the first question for her.
This one is from Jacqueline with Fox 5. Is the county planning on extending the stay-at-home order? If so, for how long? And if not, why?
Well, that's a great question. And if I had the answer to that, probably I should go to Vegas. We have not peaked yet. So we need to peak and then see what the number of cases look like after the peak point. And then when we get to that point, then we can talk about what social distancing strategies that we can lighten up. And it will be a gradual approach, just as our approach with implementing social distancing strategies. It was probably a little more than gradual, but it was several different strategies at a time. So we will do something very similar in the reverse, but at what time we will do that, I cannot give you a specific time today.
All right, thank you, Dr. Wooten. This next question is a long one, so bear with me. This one is from Cheryl Clark. And she says, the CDC, and this is a verbatim quote, recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, like in grocery stores and pharmacies, especially in areas of significant community-based transmission. Can you clarify if the federal or state or county guidance extends this recommendation to anyone who is all by oneself outside of one's home in open air space, such as on a walk around the neighborhood, not with one other person or other people, or maybe working in the yard, gardening or mowing the lawn by oneself with no intention of coming in contact with another human being or touching a surface that someone else has touched, maybe on a solo hike around the neighborhood? Perhaps the recommendation is to have a mask ready around the neck, quick to deploy if a neighbor lurches toward you or is too close. But does one need to cover one's mouth and nose with a mask if one is by oneself outdoors? Thank you for your clarification.
Well, thank you, Cheryl. And obviously the question is, if you are by yourself inside your home, there is no reason to wear the facial masks. As has been stated in many of our briefings, when you leave your place, cover your face is the mantra that we have promoted. And if you are walking on the sidewalk, you have no idea who you are going to come in contact with. So we want you to be ready. Again, the mantra, if you leave your place, cover your face. We have recommended locally that individuals, when they're going out to conduct essential services for themselves, or if they are an essential worker, to utilize the facial coverings. So the order initially included grocery stores, convenience stores, pharmacy and drugstores, as well as restaurants were included. And later, banks and transit systems were included. Again, those were actual areas where we ordered the businesses to utilize the facial coverings, and we strongly recommend it for the general public. As you go out, when you leave your place, your house, your residence, to cover your face, have it to cover your face and have it available and ready. If you are, say, in your yard or and the neighbors come by, then you want to practice social distancing. The other thing with the facial coverings, they are not replacing anything else that we have recommended or issued in a health officer's order. This action is in addition to. So I hope that clarifies your question, Cheryl.
Thank you, Dr. Wooten, and that concludes our questions for today. We always like to end these media briefings with a positive note, and yesterday I mentioned how our local baseball community is stepping up to the plate to provide meals for our first-line health workers, and I want to thank the San Diego Union for giving us that story. Today I want to tell you about first responders taking care of, well, first responders. On Friday evening, San Diego police officers, lifeguards, and firefighters, along with deputy sheriffs, gathered outside 7 local hospitals and turned on their lights and sirens to honor medical workers. This happened all across the region at UC San Diego Medical Center, at Scripps Mercy Hospital, at Scripps La Jolla Hospital, at Sharp Memorial Hospital, at Rady's Children's Hospital, at Kaiser San Diego Medical Center, and at Alvarado Hospital. Tributes like this are truly inspiring, and they are happening not just in San Diego, but in other cities all across the nation. We ask a lot of our police officers and lifeguards and firefighters and deputy sheriffs, and to hear that they are doing this for healthcare workers is, to me, just amazing. I want to thank everyone who participated. Keep flashing those lights. Together we will light our way out of this darkness. Just a couple of reminders. Excuse me. Finally, as I mentioned yesterday, we will not be providing a live media briefing tomorrow. But rest assured, there will be plenty of people here all day tomorrow and throughout the region working on this pandemic response, and we will send out a media advisory with information. In addition, our coronavirus website at coronavirus-sd.com will post the latest numbers by 5 p.m. tomorrow. As I mentioned at the beginning of this media briefing, we are kicking off our public awareness campaign. We hope everyone will take the opportunity to visit livewellsd.org/PSA to gather the information on what you can do. #StayHomeSD. We love to have pictures and signs showing who you're staying home for. And again, our mantra on that campaign is stay in place, maintain space, and cover your face. We'll be back Monday for our regular media briefing. Until then, have a happy Easter, and please celebrate it online and not in person. Enjoy your Sunday, and remember to live well, and to stay well, stay home. Thank you.